Good
How
morning.
are you today?
I'm good. How are you doing?
I'm doing wonderful. You're here to talk about a really important topic. So I have a lot of questions, so let's get started. What are some of the challenges that are surrounding a lung cancer diagnosis and treatment?
Yeah, lung cancer or any cancer when you're diagnosed is certainly challenging. It provokes anxiety. People feel very differently when you're told you have cancer as opposed to heart disease or other types of indications. As a cancer doctor and researcher, it's never easy when you're talking with patients about that initial diagnosis. The conversation can shift though, and because we have new drugs, we have better drugs, this has really changed how we approach patients who are diagnosed with lung cancer, and I think that gives them more hope.
So every September, there's a World Conference on Lung Cancer, and some of the most exciting data at the World Conference on Lung Cancer is really focused on unresectable stage 3 non-small cell lung cancer. Can you tell us more about that type of disease?
Yeah, it's nice to actually talk about stage 3. Again, as a lung cancer doctor and researcher, we don't get to talk about it as much. And the reason is because we haven't had really any new indicated drugs approved in this setting for as long as I can remember. For those patients who have stage 3 unresectable, that means we can't do surgery to remove the cancer. That means we use chemotherapy and radiation. This is called combined modality therapy. It is given as a curative intent therapy, and we then hope for the best. What does that mean? Well, a lot of patients in stage 3, even though they undergo this curative intent therapy, the cancer comes back. And when it comes back, then it's tougher to treat. So what's really been exciting to hear about and talk about is the stage 3 data that was presented at the World Lung Conference. This was Dr. Antonio who reported that in patients with unresectable stage 3 lung cancer, you could give them combined chemotherapy and radiation, and then follow that with an immunotherapy, IO drug, Imfinzi or durvalumab for 1 year, and that led to improvements in both keeping the cancer away, and his update just a few weeks ago was that overall survival, how long people lived, also significantly improved. So this has proven to be a real game changer in stage 3 lung cancer, and it's again refreshing to talk about. I will say that the study was called Pacific, and it is an AstraZeneca-sponsored study. I do consulting with AstraZeneca, several other companies, but I was not involved with the actual study itself.
Of course, that sounds really exciting, especially for those that might have a lung cancer diagnosis. You mentioned something about immunotherapy. Can you explain what that is?
Yeah, immunotherapy is something we've been fascinated with, the immune system. We hear about vaccines. This is a different type of way to attack the immune system, or empower the immune system is actually a better terminology. What some very novel and research scientists have done, in fact, one just won the Nobel Prize the other day for this work in immunotherapy with checkpoint inhibitors, is that our immune system is really great. It surveys what's going on in our body and gets rid of cancer cells. What cancer cells have done to combat the immune system is develop these defense mechanisms. So they are able to evade the immune system, and that's how they get to grow and cause problems inside of us. What these new drugs, immunotherapy drugs or checkpoint inhibitors, do is that they are able to take down the defenses that the cancer cell has developed. And thus, it allows your own immune system to find those cancer cells and destroy them. And that is what's really interesting, it's what's really novel about the type of therapy that we have now.
And so it really sounds like early detection also can really be critical. So how would someone know, if they might have lung cancer? What are some of the common symptoms?
The common symptoms in lung cancer are very challenging, especially for, again, someone who sees these patients and many patients. It starts with a cough. Now, how many people in America have a cough every day? Gosh, I don't want people to go see their doctor because they have a cough. And of course, we are entering flu season as well now. But cough is one of the things that starts, and it's usually a persistent cough that doesn't go away. Unexplained weight loss is another not good sign. As many challenges as we all have of trying to lose 5 pounds or 10 pounds, when someone loses weight unexplained, that's a bad sign. And I think that those are the things that I look for in folks to try and see if they may have something wrong with them, with their body. Also, if you have a history of smoking, that can increase your chances of having smoking-related cancers, including lung cancer. So there's not really one symptom, but it's usually a constellation of several symptoms that lead to this.
Well, Doctor, thank you for giving us an overview and talking about the new data and some of the new treatment. What would you say to patients diagnosed with stage 3 non-small cell lung cancer?
Yeah, for any patient out there who's diagnosed with stage 3 non-small cell lung cancer, there is a new standard of care. You have to get treated, if you can, with radiation and chemotherapy, and we're delivering that on a curative intent. And now, as opposed to a year ago, you can potentially receive durvalumab or Imfinzi, an immunotherapy, for a year afterwards. Now again, some patients may have side effects or some pre-existing medical conditions that won't allow them, but there is a new standard paradigm for the treatment of stage 3 unresectable lung cancer, and this makes it exciting. We're excited as medical professionals, and patients have new options, and that's really why we're all doing this, is to give hope, give new options, new opportunities for patients so that they could receive these treatments and hopefully live better and healthier lives.
Well, Dr. Kim, thank you so much for giving us more information, and thank you for joining me today.
Thank you.